Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, our Senior Director for Continuum Health Services, Dr. Ronald Schwartz, and we're very happy to have a special guest with us once again this week, Sierra Drevline. She is the Director of Employee Health Services for Masonicare. Welcome back, Sierra. Thanks for joining us.
Thank you.
Great to have you again. You know, Dr. Schwartz, I actually thought we'd begin with you today to bring us up to date on COVID-19 booster shots. There have been more developments with the Moderna and Johnson & Johnson boosters this week. Where do things stand right now?
Well, once again, an excellent question, Sandy. And, you know, I guess boosters are the latest buzzword for COVID. So I do have, once again, a nice article that kind of summarizes where things stand. And again, this was a multi-page article that I condensed to a little more than a page. Obviously, I can't memorize it, so you're going to see me kind of looking down and reading a bit. I hope you don't mind that. But what this does is kind of summarize where things stand right now with boosters. And some of this are quotes from experts and things that I'll read to you as well. So the title of the article is "More COVID-19 Boosters Are on the Horizon, but not everyone will need one, experts say." So it starts by saying advisors from the U.S. Food and Drug Administration voted unanimously to recommend emergency authorization of a booster dose of Moderna's COVID-19 vaccine, and a day later did so again for a booster of Johnson & Johnson's vaccine. So the group voted to authorize a booster shot of Johnson & Johnson's vaccine for Americans 18 and older at least 2 months after they get their first shots. Johnson & Johnson said studies showed boosting at 2 and 6 months can bring effectiveness up to 94%. So that's interesting. So they say if the FDA follows its advisors' recommendations, more than 90% of people vaccinated with the Johnson & Johnson shot, and this is nearly 14 million people, will be eligible for the booster right away. So this is a quote from Dr. Paul Offit. He's a member of the FDA Vaccines and Related Biological Products Advisory Committee. That's a long committee, but anyway, he said anyone who got a single shot Johnson & Johnson vaccine can benefit from a second dose of it. Meanwhile, Moderna's emergency use authorization request mirrored the groups authorized to receive a booster dose of Pfizer's mRNA. Yet some experts are noting that while antibodies may wane over time, the initial 2-dose regimen for both the Pfizer and Moderna vaccines is still holding up against severe COVID-19 infection. And that's pretty important. We'll follow this up a little bit now with another quote from Dr. Offit. And he said that proper expectations need to be set about what vaccines are supposed to do and how they remain effective. So this is a quote from him. He said, "We have to define what's the goal of this vaccine. If the goal of this vaccine is protection against serious illness, meaning the kind of illness that causes you to seek medical attention or go to the hospital or the ICU, the current vaccines as 2-dose vaccines are doing exactly that." And he said, so you don't really need a booster dose, at least as far as those data are concerned. The committee recommended, this is not a quote now, I'm just reading more of the article. The committee recommendation for Moderna's booster is the same as the one granted last month for the Pfizer third dose. It's authorized for people older than 65 and people 18 or older who are at risk for severe disease or who live or work in a situation that puts them at a higher risk for complications or severe disease. And Dr. Offit said that although he voted to recommend half-dose booster shots for some people 6 months after their first 2 doses of Moderna's vaccine, he doesn't think everyone needs one. So this point I think is important as well. And this is a quote from him. He said, "I do worry about the sort of 18 to 29-year-old because that's the group that has a higher risk of myocarditis. That's inflammation of the heart muscle," he said. So without sort of clear benefit that third dose is necessary, I think we've created this kind of third dose fever in this country because of the way this is played out. So that's interesting to talk about. Now I'm just going to summarize. So we're in the home stretch. So hang on just a few more minutes. More than 9 million people have received the booster dose of coronavirus vaccine, according to the latest data from the Centers for Disease Control and Prevention, which is nearly 5% of those who are already fully vaccinated. And they all go on to say the number of people getting booster doses is currently outpacing the number of people getting their first doses of vaccine, according to CDC data. More than 1 million doses were reported administered last Wednesday, but just an average of around 230,000 people are starting the vaccination process each day. And finally, President Joe Biden highlighted progress since July when nearly 100 million eligible Americans remained unvaccinated, but said the nation is in a very critical period and urged more to be done. And this is a quote from him: "We're down to 66 million, still unacceptably high number of unvaccinated people," he said. "Now's not the time to let up." So you see, there's a lot of discussion, a lot of things that are being looked at, a lot of things moving forward. And like I say, we're just going to keep abreast of the news and what's happening. And as we do these shows, we'll definitely keep everybody informed. So since everybody was so good in getting through that long discussion that I had, here comes my inspirational quote for the week, which says, "Kindness is language the deaf can hear and the blind can see." And that was actually said by Mark Twain. So I thank everybody for all of their kindness and working together and being diligent, and we're just continuing to move forward in a very organized and a very team-oriented approach. So thank you, and I always say health and peace. Thank you.
Thank you so much, Dr. Schwartz, for bringing us up to date and for always setting us on the right track with your wonderful quotes.
Well said.
Well said. And Sierra, here at Masonicare, you've been spearheading a massive effort to have clinics for our residents, patients, and employee team members. How has that process been going?
Thank you, Sandy. That process has been going very well. So we started our booster clinics back September 30th, and we started at the Health Center and one of our assisted living facilities. And since then, we've had clinics about twice a week. Since then, we've had 12 clinics. Hundreds of residents have been vaccinated, and over 200 staff have been vaccinated as well with the Pfizer booster dose. Right now, we work with 3 pharmacies, which gives us a lot of flexibility with scheduling, and we're able to get various times for all the shifts. It's been working out very well as we monitor what the ACIP committee is going to determine for the booster doses for Moderna and J&J. All the pharmacies that we work with have all 3 COVID vaccines available. So very excited for the upcoming clinics and getting more people vaccinated with the booster. Thank you.
We thank you so much. That's a huge effort and it's much appreciated. And finally, JP, as a state, we're in pretty good shape at the moment with rather low positivity rates, but we know that we all need to continue to stay vigilant and work together to help keep one another safe and healthy.
Sandy, first, I want to thank Sierra and her team for such a heavy lift to be able to pivot and have these clinics. We're definitely seeing the results of our staff and our residents wanting the booster. So thank you, and thank you for all the team members that you work with that have allowed us to be able to get this done. I know that we're going to continue to see things change as we see more information coming from the federal government on the boosters, but I can't tell you how proud I am of Sierra and really the entire group that she works with, the leadership that is within Masonicare that is really pushed to get this out. So thank you, Sierra, for all that you are doing and have done. Dr. Schwartz, it's always interesting hearing your comments regarding COVID, regarding really how it's being addressed. And, it kind of dawned on me a little bit today that we've been doing this for a while. And I can tell you that every week now, I feel more optimistic that we are getting closer to really being able to live through COVID in a more normal fashion. And Sandy, you asked about our positivity rate in Connecticut going down or really being at a low rate, and I'm very encouraged by that. However, the side of me says the holidays are coming, and because of those holidays, we have to still be very vigilant and keep a very close eye on if there are spikes between now and I would say mid-January, to see if we do see any unintended spikes. However, if we continue to see people get the vaccinations and get the boosters, I think that's going to help us a lot. And I'm happy to say within Masonicare, we have seen a drastic decline in COVID cases that are being cared for in our system. And we will continue to look and monitor if there is an uptick in the positivity rate. But I can't tell you how proud I am of what our staff have done, but also the resilience of our residents that we get to see, I think, a little more regularly. Yeah, last week I had a meeting with some of the residential living residents, and just watching their faces light up when they saw many of us in a room to really just talk about what was happening with Masonicare, and to get the notes after saying, thank you. This has been a year and a half to 2 years of not having this true interaction. And that's what we're all about, is those connections. You see behind Dr. Schwartz, the hands holding our logo of thank you. It's really us pulling ourselves together, and our team is stronger because of that. So thank you to all of our staff at Masonicare. Thank you to all of our residents, and thank you to all the family members. I know this has been a very challenging time, but we are coming out of this, I think, in a stronger manner than we were before it started.
Absolutely, JP. Thank you so much. As you say, we are together, Masonicare strong. Well, I want to thank all of you once again for sharing your time and your insights with us today. And of course, we thank you for watching from home once again. Until we see you next time, we hope you'll stay safe and stay well.